Hi, my name is Omar Harris, and I came into Dr. Jason Emer's office to treat acne scars. Around sophomore year, I had some acne. It wasn't too much, but it was there. And towards the end of my sophomore year, it just kept getting worse and worse and worse and worse. And for like about a year, I was on Accutane, and that really helped the acne a lot, but it left me with some pretty harsh scars on my face.
The first step in his treatment plan is to stop pigment production. And we want to ensure that when we do CO2 on him that we don't create any post-inflammatory pigmentation from the laser.
After the COSMELAN pill, my face feels a lot smoother actually. The scars, they do look improved a lot. Like the skin, it peels and keeps rebuilding and peels again, and that causes new skin to come up and it makes the scars less dense. Today, I'll be starting off with a salt facial, and then we're going to be moving on to the CO2 laser for my acne scars. I'm a bit nervous, but I trust Dr. Jason Emer. He's one of the best.
So this deeper laser will be able to help him build more collagen deeply. The other one's going to do more exfoliation. The combination of this treatment with the next treatment that we're going to do, active FX, is called total FX. We're now doing the second portion of our procedure for acne scars today, which is the fractional CO2 laser resurfacing. He's been nerve blocked and topically numbed, and this laser is working to slough the surface and remodel the superficial textures of the skin. We pre-treat the skin with a COSMELAN peel, which lightens and suppresses melanocyte activity. And then we go and do a fractional resurfacing.
I did my CO2 laser about 3 weeks ago, and I started off with a lot of blood and redness and like pinkish scabbing, but not fully scabbing yet. And about 2 to 3 days, it really started to scab up. And as the days went by and I did my daily regimen, the scabs would slowly fall off. Really not painful at all. The results look really good. My skin's a lot better. The scars are not as deep as they were before. Today I'm going to be finishing more of my treatments. I'm going to be doing Bellafill and Nova Thread.
We have a follow-up of a patient that we did the CO2 laser on 4 weeks ago, and he's doing actually phenomenal. So with the focus, you can see the redness is all within his scars. That's exactly what we want. That's collagen production, and the reason he has that is because we did a deep type of CO2. And the deep CO2 takes at least 6 to 8 weeks to heal, but we hit it in between that time period with things like this called laser genesis that deeply heats the skin to build collagen. So if we take a look as we do more passes, he's gonna get red and feel heat. We want that deep dermal heating to give him some collagen production. And what that also is gonna do is decrease a little redness in his skin over time. So he'll be more red right now, but the redness will go down much more quickly. So that's laser genesis. And we'll move on right now to some Bellafill. We're using Bellafill, which is a filler that has in it acrylic polymers called PMMA, or polymethyl methacrylate, and a collagen carrier. When it's injected into the skin, it forms a little scaffold under those scars to help build collagen in those scars, and it literally plumps them up. Now he's gonna need more of this filler over time, but this is a good starting point. We're going right underneath those scars to build collagen. That's Bellafill injections for acne scars. We're gonna hold here, and then we're gonna finish with our last part. Now we're adding some collagen producing sutures or threads. These are called PDO threads. These are made of a material that builds collagen over time, and as you can see, they're very fine horsehair. That's gonna go in a cross-hatching pattern or a scaffold pattern directly underneath his scars. And this does a needle subcision, which basically is breaking apart any bands underneath the skin, but it also helps build collagen over time in his scars.